Hi, I'm Christina.
And I'm Randy, and we're nurse practitioners with the Country Health Clinic. And you're joining our show it's the Treat 'em, Not Street 'em podcast, right? And you'll learn more about what that means as we go. But in our podcast, we're going to talk about integrative medicine and complementary medicine. Christina, what are some of the other things we're going to cover?
Oh, just so many of the fun things that we get to partake in here. Ozone therapy, IV therapy, supplements versus pharmaceuticals, different options, red light therapy.
Now, you still prescribe, right?
I do.
Yeah, so we both have prescriptive rights and we can prescribe all the pharmaceutical agents, but we're going to talk about why there's so much value in combining pharmaceutical agents with what some call the alternative or the complementary. We like to call it alternative, and you're going to learn a little bit more about that in this podcast today.
It's going to be fun. Stay tuned. So my story begins with being a nurse practitioner since 2003. Randy and I both graduated from the ISU nurse practitioner program, so it's actually very exciting. So I started off working with a doctor that did more of what we call back then functional medicine. Now we call it integrated medicine. And what that really meant was I had an amazing opportunity to really learn kind of the root cause of things, not just look at a diagnosis and then a medication, but really what are the basic fundamentals that we need to cover first. So that's how I started off in medicine 18 years ago, and no matter where I have worked.
Can you remember a patient that you had where you thought, this goes beyond pharmaceuticals, this is really an integrative approach?
So one of the reasons that I got hired to work with this doctor 18 years ago was to actually take over the nutrition side of things. So they had a nurse that was going back to school to become a nurse practitioner, and I stepped into her place to teach the nutrition for what they dealt with a lot back then was insulin resistance. However, 18 years ago, nobody really believed in that concept of insulin resistance.
Right.
So my first experience that really hit me was we're teaching food as medicine and how to reverse things via the food that we put into our mouth. So I think we have a very similar story in that was kind of the introduction was food is super important.
Yeah, so my experience is very similar. My business partner and I purchased an urgent care, and we went to the closing, just like when you buy a house, you go to an attorney's office and you close the purchase. And when we were leaving, my partner says, hey, here's the business card for this dietitian that we need to hire. And my thought is, what are you talking about? We're not hiring a dietitian, we run an urgent care. And his response was, oh, I can't practice medicine if you don't teach people how to eat. So we're going to hire this dietitian, and anyone that comes into the urgent care that has cardiovascular disease or high blood pressure and diabetes, and he just started rattling off all of these things. And I remembered from school, oh yeah, those can be impacted by diet, but you know, school kind of trains us that your first interaction should be a prescription medicine. And my partner's like, no, we're not going to practice medicine that way. And that was an eye-opener for me, right? That was 20 years ago, and I thought, goodness, I've got a lot to learn. So that was kind of my first introduction into this integrative space.
Yeah.
So
interesting. Very similar.
Okay, excellent. So let's talk about integrative medicine. What is integrative medicine? And so let's kind of introduce integrative medicine. And then what happens if we don't use integrative medicine? And then let's bring the resolution to how you should use it.
Perfect.
Okay.
Christina, tell me, how would you define integrative medicine? Because we talk about doing that, and many people really don't understand what is integrative medicine. So how would you define it?
So the way that I explain to people what that term integrated medicine actually means to me is really that I'm looking at the basics. We go all the way back to what types of food are you eating? How are you sleeping? Even back as far as tell me a little bit about the way that you were born, which seems so weird, right? Why are you asking me that? Were you born vaginal or C-section? It actually makes a difference when we're talking about integrated medicine. How did you come into the world? What bacteria were you exposed to? So that's kind of those fundamental root causes. Tell me about the way that you sleep. Tell me about your environment. Tell me about your relationships, because stress impacts how our body heals and whether our body heals. So we get a lot into asking personal questions about people. And I love that. I think a little bit of that is maybe our nursing background, because in nursing, we're really taught that whole person, spiritual, physical, all of that. And so I think that's why I've been drawn to this term integrative medicine, is we're looking at the root causes: food, exercise, medicine, toxins, environment. And I think over the years, just as you have, I have learned the impact that all of those things have on us and how much power we actually have to influence those things, how much all of the things with our environment actually impact our genetics. So I love that we can learn a little bit more of, we may be born with this certain genetic predisposition, but we can totally change the outcome by our environment. What do you what do you think, or how do you describe it to people?
Everything that you say I agree with, and I'm going to share what my belief of integrative medicine is by an experience that I had. I was asked to speak to a group of naturopathic practitioners. And this group of naturopathic practitioners were asking me, what's my style of practice? And I said, well, I'm an integrative guy. So I believe in pharmaceutical medicine, and I believe in vitamin and mineral supplements. You got to change the way you eat. You got to focus on your sleep and your stress level and all of these integrative pieces. Energy medicine has a part of that. And one of the individuals in that room got a little snotty with me and said, well, we're not into any pharmaceuticals, so, we can't be friends. I mean, they didn't say that, but you could tell that there was a rift instantly that happens. And I paused for a second. I said, okay, hold on. How many in this room take thyroid medicine? And a couple of hands went up. And how many in this room take hormone replacement? And a couple of hands went up. And I said, look, you guys all believe the same thing that I believe. You believe in doing what works. You got to figure out what your needs are and what works. And you can't confine it to either a natural or a pharmaceutical. You just have to look at the big picture. So for me, integrative medicine looks at all of those interventions that have research and some evidence that says this is going to make a difference to improve someone's health. And in many cases, that might be a pharmaceutical, or that might be vitamin and minerals. Like you said, it might be fixing the bacteria in your gut, your microbiome, your sleep, your stress levels, your relationships, because you help someone try to detox that's in a toxic relationship, forget about it. It just isn't going to work. You've got to sort through all of the potential challenges and then apply those interventions that work.
I really love integrated medicine because you really get to know somebody. They're not just coming in, you're establishing a diagnosis and you're handing them a prescription. And so many people these days, they don't want that. They want to know what else they can do. So that's why I love that concept of integrated medicine, is I get to create relationships and I get to really know people and really help them make a huge impact in their life and have control over it. They're in control of what they're doing. They're in control of whether they want to go to bed at a certain time, whether they want to put that food into their mouth or not, whether they want to take that handful of supplements, and they know the reason why, and they still get that choice of whether they want to do it or not, versus just being handed, here's your prescription, this is all you can do about it. And really, people these days, that's what they're looking for. They want to be in the driver's seat, and we're just there to implement how to get down
and I think that
location.
Everyone does this naturally anyway, because when I'm sitting in a conventional office and I'm asking an individual, well, tell me what medicines you take, they oftentimes will rattle off these medicines and they'll say, well, and I take magnesium at night and I take a vitamin B. And sometimes traditional practitioners will say, don't tell me the supplements, I'm only interested in the pharmaceuticals.
Right.
And my response is, no, most individuals, I don't know what the studies show, but most individuals take vitamin and mineral supplements and some pharmaceuticals, and so naturally they're drawn towards integrative medicine regardless of what their practitioner does, right? Just when they come here and they visit with us, we're able to look at all of those and from a perspective just kind of point them and guide them, and just like what you said, it's their choice. They get to pick and choose those interventions that make the most sense to them.
And they're much more likely to follow through because they are in the driver's seat. They are understanding why they're doing it. Randy and I both give people a lot of homework. We encourage people to look into these things, to learn these things for themselves, to understand why they're doing it, puts them in the driver's seat, and then makes them more accountable, really, and they can make those choices. And so that's the other reason that I really love it, is that we're doing a lot of education. We're really teaching people how to be their best selves by all of the things within their life, not just coming in and getting a 5-minute visit of here's your diagnosis.
Correct. Christina, when someone comes to the office, how do they know if they're getting an integrative approach or not?
Well, I think one of the most important questions to ask somebody is, what are we doing today? What can I help you with? And based upon those questions, I go into those basic fundamental questions. And so I think that people can always call and ask, who in your office does integrated type of medicine, or maybe they don't even know what integrated medicine is. That's what I find the most, is people don't know that. They're not necessarily seeking it out. Now, if there is a clinic like the Country Health Clinic, they know that. They're seeking out this type of care because they've done their research and this is what they want. And so by asking certain questions to the patient and asking those basics, that is their first introduction to integrated medicine, if they haven't already been introduced to it, is these are the basics that we're going to look at. We're going to talk about the basics. I tell my patients or the people that come to see me, we are going to get really good at mastering the basics. And then once you master those basics, then we'll look outside at, what else to do. And mastering the basics oftentimes includes doing all of these, what people consider alternative type treatments, hyperbaric oxygen chamber, red light therapy, different types of things to help heal the body, as a side to just doing the pharmaceuticals or even testing. A lot of times people will come to you and they've had thousands and thousands of dollars worth of testing, right? And so what I teach people is always ask your medical provider, why are you doing this test? And what is the benefit? And does it change the outcome? Because one of the reasons that I think you and I both love integrated medicine is that we are saving healthcare dollars. We are looking into what are all the things that you can do for yourself first before going out and having a $3,000 MRI or ending up in the emergency room because you waited too long to take care of yourself. Part of our goal is to teach people how to take care of themselves so that we save healthcare dollars. We spend the most amount of money of any industrialized company or country, and yet have the worst health outcomes. So what we really love about what we can do is help people become their own best advocate.
I recently just barely read a study. The U.S. Food and Drug Administration just named the #1 cause of death the American diet. That's just been printed. That's fascinating that what we actually put into our bodies and consume is the #1 cause of death, not heart disease, not diabetes, not all. And so a person has to look at what's going into the system. And when people say, how do I know if I'm getting integrative medicine? To me, this is the acid fast rule. If the only intervention that you get to treat an illness is a pharmaceutical agent, it's probably not integrative, because there's way too many other interventions that make a big difference. And you've named a couple of them, and we could spend all day long talking about all the complementary pieces that have some evidence behind them that would help reduce the burden of illness and make someone a little bit healthier. Sometimes people will say, well, what's the difference between complementary or alternative? Those are terms that have been used a lot over the years, and I don't particularly love the term because in some way it's the ugly stepchild, right?
Or one or the other.
Yes, you can either, a complementary might be it's not the primary intervention, but it might complement the primary intervention. And there may be some truth to that. Alternative is really the ugly stepchild because the alternative is, it's what are you gonna do besides what actually works. And so I think they're actually bad terms. I like integrative the most because there are so many things that we do that have synergy. And so they do complement one another, but it's not necessarily that one is more important than the other. I just mentioned that if what we eat is the #1 cause of death, then the primary intervention should be our diet and how food affects the body. What is your take on that between talking about complementary versus integrative versus alternative? What are your thoughts?
I think those are terms that a lot of people they're thrown around. They don't really know what they mean. I think what we maybe feel the most as providers that do integrated medicine is that rift between mainstream medicine and this other alternative side. And I think what you and I have done very well at over the years is combining those two. That's why we call it integrated, but it's kind of a big word. Like, what does it mean? It means that we look at all of the options. We're not so far on this side or so far on this side. It's meeting in the middle, and really, what is the best thing for the person that is coming in to get the treatment? How can we help you, again, live your best life? What are all the things we can do? And we will think outside the box.
Yeah, something that I've wondered where alternative comes from is it covered by my insurance? Because sometimes if it's not covered by your insurance policy, it must be alternative.
Right.
But your insurance doesn't cover your gym membership.
Right.
Would you consider that alternative medicine? Right? It's it's integrative in the finest moment. So just because insurance covers it doesn't mean, or just because insurance doesn't cover it doesn't mean it doesn't have value.
Right.
Or there isn't research, because more and more insurance companies are in the business of not covering anything.
Right.
They're trying to reduce their financial burden and push everything back to the consumer anyway.
Right.
So the consumer needs to be wise and actually identify those things that are going to make them better.
I also like we had talked a little bit earlier about the difference between evidence-based medicine and how a lot of medical providers are they are somewhat opposed to what we are calling integrated or alternative medicine, because if there's not a double-blind, placebo-controlled study, that it must not work. And there is, what I love now is that this is something that is becoming more mainstream. You know, you can get on YouTube, you can read book after book after book, which we always are going back and forth about all the new books that we're reading. There is evidence now. They are actually doing studies on alternative type treatments. But the thing is they're not oftentimes done, because if there's not a big pharmaceutical company backing that $1 million study, they're not going to do a study.
Yeah, you know where this has really taken shape is in the COVID era, because there was no evidence-based medicine for how you address COVID. And so you started seeing these integrative approaches. You would read about vitamin D, how important is vitamin D, and vitamin C and zinc, right? A little bit of exercise and a little bit of sunlight. And we told everyone, socially distance yourself. Don't get around your friends and family. Depression goes through the roof. Suicide goes through the roof. And we start thinking, oh, we've got to rethink this approach. So those hardcore allopathic medical practitioners that say, show me the evidence.
Right.
And what they're referring to is that double-blind, placebo-controlled trial. You've got to recognize that we live in an environment that's constantly shifting, and the evidence is always trying to catch up with modern day. If we wait for the evidence to figure out how to keep our immune systems healthy, COVID becomes a big problem.
Right.
But if we start integrating many of these natural approaches of supplementation and lifestyle, we find that people actually do better if they get COVID, or at preventing COVID, or keeping people out of the hospital from COVID. So I think COVID is a really good case study of how integrative medicine is so valuable in today's environment.
Right. Absolutely.
Christina, one of the things that I think is paramount in this integrative approach is it just takes a little bit more time. I've been an owner of urgent care clinics for a long time, and there's a typical statement that we use called treat them and street them. They come in, they're there for 10 or 15 minutes, and they move out. And if you've got a sprained ankle or you've got a little laceration that needs sewed up, that model works. But when we're talking about chronic complex diseases like Epstein-Barr, chronic fatigue, fibromyalgia, diabetes, irritable bowel syndrome, you can't treat people and street people in 15 minutes. You've got to spend the time and dial it back. So people will say, well, how do I know if I'm getting a good integrative approach? The answer is, how much time are we spending sorting through this dynamic? Because I oftentimes will spend an hour with every patient and just go through a series of questions and answers. And then, like you said, you give them a little bit of homework. Look, we're going to investigate these areas. Women are a little bit better at men, sorry guys, in the fact that they have a gut feeling. They get a sense of, is this going to work? Because women are very dialed into their health. They're very dialed into the perspective of, I've tried these things and I haven't even heard of that. Let me do a little bit of research. Let me ask my friends. Let me search the internet. They ask a lot of questions. I think that predicts if there's going to be a good outcome with integrative medicine. What is your thought? How do people know if they're getting a good product?
What I find is that I think a lot of what you and I do is word of mouth. People end up in our office because they have heard from somebody else the approach that we take.
Mm-hmm.
If people want the approach where they go in, they get the diagnosis and they get the medication, which there are lots of people that's what they want. There is no problem finding that. And if those people, if we're asking the questions and we're going through the scenario and we're saying, here's what I want you to do, I'd love to see you back in 2 weeks or in 4 weeks. When they show back up, those are the people that want integrated medicine. They may not even know what that term means. What they want somebody to do is listen and care. It doesn't matter how smart you are. It doesn't matter the credentials behind your name. What matters is if you took the time to look someone in the eye, took the time to act like you care, because we do. We would not be in medicine if we didn't care. Medicine is very detailed. It's very daunting at times. It takes a lot of brain power, and we wouldn't be in medicine if we didn't love it, because doing this type of medicine takes a lot of investigation and a lot of time and a lot of listening and a lot of doing different types of things and seeing how that person responds to it. So what I find is there are lots of people that just want the quick fix, and there are plenty of people in the world to fix those people. The ones that end up coming back to us are the ones that want a different approach.
And reality, the people that come here have already been through the treat 'em and treat 'em approach 100 times and they have failed, right? They're not getting better. They still have all the same symptoms, or they're getting worse, or they have a terrible side effect, or they still can't sleep at night and their tummy's bothering them. And so those are the people that come in. So part of the reason it takes just a little bit more time is you have to sort through all of the things that have already been tried that haven't worked, to kind of back into that comfortable spot for the individual, that patient of, hey, why don't we make this the plan for the next couple of months? And then we can do a telemedicine consult, or you can come back. I mean, we have people that come and spend the entire week here. It's kind of like a health retreat. Come on Monday, leave on Friday, and let's sort through everything that we can for this week, so that when you go home, you've got a course, you've got some homework, and you got some interventions, and then we can do some follow-up over the telephone. So it's a rhythm. It takes a little bit more time.
And I absolutely love coming to the clinic, because seeing the people that have been coming here for year after year after year, and they're here for their 6-month just kind of tune-up. I love it, because we're never done treating ourselves. We're never done taking care of ourselves. It's an ongoing process. It's work to stay healthy. It's not just as simple as, here is your intervention and good luck, you're going to be great. I love what we get to do is meeting the people month after month after month and seeing them over and over and really getting to know them. And so many of them very sick, and seeing them healed, and then coming back for their I like to call it their tune-up. They really are here to just get back to the basics, get those fundamentals, solidified, and then work on all the other things that they can continue to work on, because being healthy never ends. And that's what I love about this approach as well, is creating relationships.
When people are left to their own devices, we tend to revert back into those traditional patterns that got us in trouble in the first place, right? And so there's a little bit of an accountability aspect. There's a little bit of, we're the accountability buddy to help those individuals when they go home stay the course. So we use that as a reference to lickety-split assembly line medicine. And what we do is not the assembly line medicine format. So treat 'em and treat 'em is derogatory in terms of you got 15 minutes and then you're gone, and I'm going to move on to the next.
And I do think that people feel that. That's why they don't like generally what's happening in the medical world is, and I don't think people understand that in order to make money in medicine, that's why they get 15 minutes, because of the way that we practice medicine in the United States, because everything has been, all of the reimbursement has been reduced. So that's what's unique about this clinic too, is when you're coming in and you're paying cash, you're getting.
And this year, the health insurance laws changed, where when a practitioner sees a patient and codes that in order to get reimbursed, The coding is now based on how much time did you spend with the patient. And that's really interesting because it used to be if I did this really comprehensive physical exam in 30 seconds, I could get the highest reimbursement. But that's totally changed now. I can only get the higher reimbursement from an insurance company if I spend some time with you, right?
Yeah.
And I'm really identifying those challenges. So I think that even mainstream medicine, conventional medicine, is realizing you can't spend 5 minutes with a complex patient and figure it out, write a prescription and send them packing. That's the treat them and street them part. You've got to actually drill down and sort through what are all the causative. You talked about root causes. What are all those root cause contributors driving that illness so that we can identify them and recover from them. And so we're kind of the anti-treat them and street them. Let's
like
drill
that.
down. Let's figure it out and give you a course that will work so that when you do get back on the street, you're running. So thank you so much for joining our podcast today. I'm Randy Vaudry.
I'm Christina Finnerty.
And we're with the Country Health Clinic. We invite you to click on the subscribe button below because we want you to join our podcast on a regular basis where you can learn how to receive treatment, not just be streeted after seeing your healthcare provider.
Make sure also to click the notification link so that you know when we're together and we're on here having fun and telling you guys about how to live your best life.
And if there's anything that we said that resonated with you, send us a note, tell us that you like us, send us a comment. And for the most part, if there's something we said that resonates with you, come see us, come visit us. Let's see if we can help lighten your burden.